every semester when these first year students, second year students come through my class, I do get that opportunity to encourage them, to help them to understand that they're not alone, that someone on this campus cares about what you're going through.
With the public health also, you know that many people, they call us dreamers, but we believe the dreams.
And you're right. They may say that we're dreamers. They may say that we have our heads in the clouds thinking about saving the world. But why not? Why not want to promote health? Why not want people to live healthy lives and encourage them to be the best person that they can be?
This is Brewing Better Health, a series from the School of Public Health at the University of Nevada, Reno, where every cup sparks connection and a healthy conversation. Join Dean Muge Akpinar-Elci each month for a cup of Turkish coffee as we pour insights into public health. Today, Dean Muge is joined by Dr. Angela Heinemann, Teaching Associate Professor in the Department of Kinesiology at the School of Public Health.
Welcome, Angela. And today we will just talk about a couple things about the public health over the coffee and why is Turkish coffee. Because Turkish coffee is the connection, and we believe that as a traditionally is more ritual and just being in the moment, listen each other and do the conversation. So this is why we are doing the Turkish coffee today. And please enjoy, but also when you are enjoying, I want to talk about a little bit of the cup, because this is February episode and this is Valentine's time. And what is writing on your cup is gönül. It means love, but it also means heart and soul. It's more than just a love. It's just more connection, being the, make that meaningful connection. So again, welcome to this episode. And I guess my first question to you, also connecting with the one Turkish proverb, we call that if you one cup of coffee is remembered for 40 years. It means that you do something small and its impact lasting. It's that kind of things. So I want to ask you to, in your life, do you have that kind of moment, one small gesture or just one conversation, just make that much impact in your life and a lasting bond?
Yes, well, first, thank you, Muge, for having me. And I was so excited to have this moment with you with the Turkish coffee. I think it's really, really fascinating just to be able to sit down, to enjoy the moment, to enjoy connection, and just to take those few moments. I think we need to do that more. So thank you for that opportunity to be able to just sit down, relax, have a conversation, and enjoy this new experience. I do really love that proverb, that Turkish proverb of 40 years, that something can last for 40 years and make that impact. There have been several moments and conversations in my life that have stuck with me. One that I can remember that really has stuck with me and kind of has driven the way I live my life is, of course, from my mom. My mom was just really inspirational, a strong encourager, someone who just really loved passionately. And one thing that she taught me is I was a track and field athlete growing up, so I love sports, all sports. I even played flag football, if you can believe that. But the sport I really excelled in was track and field, and it's an individual sport, but also a team sport, which I love because you had that individual kind of competitiveness, and then you also had being part of a team. But I remember when I started really doing well in track, and I was winning races and setting personal records. One time I came home and I was a little bit down because although I set a personal record, I didn't win the race. And it was against a competitor that I've just been looking forward to beating, to be perfectly honest with you. And I didn't beat her, but I did have a personal record. I ran a personal record. And my mom shared with me that she said that winning isn't always about getting first place. that in life, winning could mean a lot of things. It could mean the effort you put into something. It could mean succeeding, past your expectations, like getting a PR. It could mean being able to just really see the value in the experience. That's what winning is. And so in life, you may not always get a medal or something that shows that you are really making an impact or you're doing something really important. But you know that it is a win. That every time you do something, you put effort into it and you're passionate about it and you go beyond even your expectations, that's winning. And that really stuck with me because I knew very early on then that although I did want to win the medal, I was young, it was important to me. What I came to realize as I gotten older is the importance of that message, that sometimes we don't always get the pat on the back. Sometimes we don't always get, the award to show, that we've done something great. But that in our hearts, we know that we still won because of our effort, because of the passion, because we succeeded in our own minds.
But I listened you in couple events. Also, you gave the keynote speaking and just a couple other things. And you talk about your childhood. It was very interesting moments and what happened to your childhood and what kind of support you receive and carry to this moment. And with your example right now is again, that kind of moment is really make us who we are right now. And but can you talk about a little bit that childhood and just how you became who you are right now?
Thank you for asking that. My childhood was very challenging. There were some challenges in my childhood for sure. But now that I'm older, I can see actually the blessings in that the things that I've learned and where it's brought me to now. And I am one of those people that really, the proverb that states, it takes a village to raise a child. I was that child. It really, truly did take a village to raise me. And I'm so thankful for the people in my life that supported me, that reminded me that my circumstances didn't define who I am, and that really encouraged me. And that's gone a long ways, Muge, because I've now been able to live my life with passion and really taking advantage of every moment, whether it's in work, whether it's with my kids, whether it's with friends. Every moment I really try to be there and I embrace, and it means something to me. And that's just carried me a long ways. And then also being able to want to encourage and to want to, I guess, even love people who may be struggling or need that support is really, really very important to me, because I know that where I am today is because people have shown me support, encouraged me, empowered me, believed in me. And so I really try to take that into my everyday with my kids, with the students that I teach, with my friends, just anyone that I encounter.
But again, this is the connection. Everything is the connection, how we can make to that relationship and how we can build to that trust around us. So this kind of support system is so important. And with the public health also, you know that what we are trying to do here is just more how we can support our families, our communities, our neighbors to make it more healthier, better world, actually, in a sense. Many people, they call us dreamers, but we believe the dreams, I guess, made a sense.
Absolutely.
And just can you talk about a little bit your work right now, what you do, and
Well,
why you are doing also?
Yes, I will. Thank you again for asking that. And you're right. They may say that we're dreamers. They may say that we have our heads in the clouds thinking about saving the world. But why not? Why not want to promote health? Why not want people to live healthy lives and encourage them to be the best person that they can be?
Exactly.
Why not have experiences where we are taking care of ourselves, our bodies, our minds, that we are looking at all the dimensions of health and we are deciding that we want to be our best in each dimension. So if that's being a dreamer, then I will be a dreamer. Dream on. I will be a dreamer.
Yes, go on.
A little bit about my work. Obviously, I teach some classes. I'm in the kinesiology department. So my role is really, I work a lot with physical activity and promoting physical activity and health in youth. And I have to say that if there's one dimension of wellness that I excel in right now, it is occupational wellness. I really truly love what I do. I believe in what I do. I believe in our mission as the School of Public Health. I believe that we can encourage, inspire, and make an impact. I do think that it's hard. There's hard times. There's things that we're up against. But I believe that it's an important. I've seen it in my work with the students. I've seen it in my work with the community, that it's needed, and that when we do things, when things are happening, and learning is taking place, and people are exposed to what is public health, what it truly is, what does it mean, that good things happen. So I'm a professor in kinesiology, and so I have the pleasure of teaching a personal health and wellness class, which, by the way, if Dr. Constantina, if my group ever tries to take that class away from me, we will not be enjoying our Turkish tea. We will be talking about it. Because I love the class so much, because it gives me the opportunity, when these students come in, freshmen, away from home, they want to go into public health in some capacity, whether it's kinesiology, whether it's being a doctor, a physical therapist, epidemiology, a nurse, whatever it is. They come and take this class, and it's about looking at their own personal health. And the reason why I really like this class is because I believe in being an example. I believe that for my kids, for the people I'm around, when I talk about public health and the importance of it, I need to be an example of what that means. Am I going to be a perfect example? No. But I strive to be a good example. Right? I even love our department, kinesiology department, where we take time off, even Wednesday during prep day, after we're done with the semester and the classes. We took a moment to go on a hike together, where we hiked up to the inn, and we just took that break, just kind of like we're doing now, to just be in the moment with each other, talk about the semester, not just all the challenging times, but really celebrating our accomplishments for the semester. And I feel the reason why I love our group is that we are all an example. We don't go into class and we're just like, you should do this, and this is what it means to be healthy. But we try to live that out for our students so they can see that it truly is important. So this personal health and wellness class that I teach, that I love so much, is it's considered a large class size because it's normally about 80 students, and I teach multiple sections of it. And it really gives us the opportunity to look at our health habits, to look at where we are, which is important for these college students coming in, to look at where they are, to figure out, are there things that we would change? How would we change those things? And then at the end of the semester, we get to go through a behavior change, where we really hone in on one behavior that we realistically can change, going through our SMART goals and thinking about the behavior that we can realistically change, and going about doing that change. Now, it's funny because what you would think is that these students would choose behaviors and they're like, oh, this is so easy. I can change this behavior anytime I want to. But what really comes out, and I know this, and I know this is going to happen, is that they learn a few things about themselves, how challenging it is to change behaviors. Maybe are they at a point that they realistically want to change these health behaviors? But what I really, really want to really point out to the students is that change is sometimes hard.
That is so.
Even though it may seem simple, that sometimes change can be hard. And that changing behaviors at a young age now can go a long ways. Making it part of your lifestyle is what we want to get at. Changing these health behaviors and making it part of their lifestyles so that when they're our age, when they're older, it's not such a, oh, I got to change this. It's who they become. It's something that they just do. That their health is improving now. That they're being an example for their future patients. They're being an example for their friends and their community. And I just really love teaching that class.
Okay, I get the message.
Oh, I
What
really
I'm
love,
taking
but that's not
from
even,
you.
that's not even the class that I'm most proud of right now. But that is the class that really gets me as far as changing health habits.
But you just what you say that is again this series what we are trying to do, how we can turn it to public health again is more human. You know, just because that is human and the human is important for
Yes.
this discipline. So you really bring to that perspective. What I know that you also work with the elementary students, and it's a very amazing job you
Oh,
do.
thank you.
And I always enjoy to attend to your events and everything. But can you talk about that part too?
Yes, but before I forget, thank you. Because when you come and you attend those events, not only do you show me that you believe in what I'm trying to do and that you think it's important, but the students and the school really are impacted by that this is important to the School of Public Health. This is important to you and ours. So I want to
This
thank
is our
you for
mission,
that.
really.
Yes.
This is our mission.
Yes, and I appreciate that because there are people in positions such as deans and things like that sometimes we don't see them as much. When you come out into the community, that
That is
message is
the-
conveyed, and so thank you. And so that I do love my personal health and wellness class. Very passionate about that class. But there is another class that I teach that's a methods class. And what I love about that class is that those students get to go with me out into the community and really promote this idea of physical activity and health. And we really get to collaborate with schools in our area and with principals and people who can really make a difference.
Because
the
everything
school.
starts in that time. What you
Yes.
say that behavioral, if you want to
Yes.
change it, it should be that time.
Yes, well, here's what we know, Muge. Here's what we know is that, especially with physical activity and health, it is not a requirement in the elementary schools here in Nevada.
Yeah.
It is not a requirement. In some states, it's a requirement. In Nevada, it's a requirement middle school and high school. But what we know and what research does show us is that our healthy habits start early. And developing those healthy habits start early. So getting those students at an early age and really encouraging them to believe in hygiene and ways to take care of themselves and physical activity is so important. Making healthy choices, so important. And so this class gets the opportunity to do that. And what we do is we go out into the schools and we do different activities. We teach health classes. We teach physical education classes. We run field days, sports days. Bring your parent to PE day to get those parents involved. Because remember, I believe it takes a village. So we want
Yes.
the parents involved. We want the school involved. Everyone is
Everybody
involved.
needs to.
Everyone benefits. And we're able to run these programs in the schools and just to kind of, again, convey the message that health is important, that physical activity is important. And what I've seen that's happened is one, amazing things. When I took over this class and we started going a little bit of this direction, the class was really small. It was about 17 students as an elective. This semester that we're in, there are now over 60 students in this class.
It's really
And I
big
am
group.
really excited about that because what that tells me is that these students are spreading the word. Here's what we're doing in this class. Here's how we're impacting the schools and the people in our community.
This is exactly with the public health. We talk always about resiliency and how we can really help the people, physical health, mental health, social health, and everything. And everything is the impact. You know, just sometimes in the university system. They think, community think that we have our research agenda, we have our interests, another piece. But for the public health side, everything is impact.
Yes.
What we do, what we teach needs to impact the community. What we do as a research needs to impact the community. Again, how we can make that connection more with the community. And I really loved with that young kids, just especially you did with the public health piece, just ask them to do just talk about it. That's what it's really, they enjoy, and I love that.
And when you see kids excited to learn about physical activity, to learn about health, it gets you excited because you know that, wow, I am making a difference. The university
this is
kids
job
are
satisfaction,
excited.
really.
Yeah. And I have to tell you, when I was thinking about it and, I was looking at the number in a year since we've done this physical activity and health collaborative initiative with the schools, we have impacted several schools in the Washoe County area. We have impacted close to 1,000 students. We have impacted over 100 university students have been involved in this. And there hasn't been a semester yet, Muge, where I'm lacking schools. I have to tell you, I was at a lacrosse game for one of my children who plays lacrosse, and one of the coach's wives who was doing the score table came up to me and she said, "Angela Heinemann, are you Dr. Heinemann from university?" And I said, because normally I obviously don't walk around saying I'm wearing a shirt. And I said, "Yes, I am." She goes, "Do you go out in the schools and do this physical activity and health, these health events?" And I said, "Yes, we do." And she said right then there, she said, "Will you please come to our school? We don't have a physical education teacher. We don't have a health teacher." And it was that connection. And she, after we did the event, I have to share with you, she took me aside and she thanked me and she cried. And she said, "Our students have never been so happy that people were coming. Your university students were smiling. They were excited to be there, and we can feel that energy."
But this is personal touch.
Yes.
And because again, everything is human, and how we can make it to that human connection.
Yes.
And in our discipline is easier. And the community, I know that they are open for that piece. But I just want to go to the one part also. There are many misinformation, disinformation is happening. And also, I believe that with the public health, we lost the trust right now. And what do you think? How we can build up again?
Well, we know that misinformation can be really harmful, especially when you're dealing with health, mental health, physical health. It can be really harmful. I think that what we're trying to do as a School of Public Health is really important, is that we're trying to collaborate and say, we're here. We're here to support you. We're here to help you. We're here to help educate on health and wellness. And that's important because I think what people believe is that we don't care, that we're not there. And that, when people look at people, they say, "Oh, this person, we can tell this person healthy by the way they look." And yes, that could be true, that the way that a person's physical appearance, but they could be struggling with mental health. They could be struggling in other ways. And so really, we need to look at the whole person, and we need to really just focus on being a supportive, a place of support, a place of collaboration, where we can really pour out this message that health is important. Health is important. Physical activity, obesity is on a rise. Yeah. We know that. That is the trend in physical activity, is physical inactivity. And that is scary when you think about that. When you think about that, childhood obesity is on the rise, and that there are schools that are not offering opportunities to talk about health and to provide physical activity.
But also think about it, if that teacher reached you in that moment, because that teacher saw you what you are offering, and that connection built in that moment, and that teacher trusts you that you can bring to something. And again, we are doing this kind of video things is specifically for that purpose. We really want to give our followers to see who we are as a person, not just lecturing them or just talking something, you need to do this way. No, this is the conversation again. But, one other question. If for students or who is following us, they may be struggling right now with many things, and the world is changing. It's very rapid pace, mentally, everything, and physically. We are not some stable stage yet, and there is many struggles and challenges happening. If somebody listening you with the struggling this many things right now, what would you want to say them really?
Well, the fortunate thing is every semester when these first year students, second year students come through my class, I do get that opportunity to encourage them, to allow them to share, to help them to understand that they're not alone, that there are a lot of people who are struggling with certain things, and that's okay. Being able to identify that, knowing the resources that are provided is so important. And what I try to do is I try to, just in that semester, help them to feel like they have that support, that someone on this campus cares about what you're going through. Somebody on this campus cares about your health, that wants to guide you and support you in that. And I like what you said about being human, because when they see you leading by example, when they do the physical fitness assessments, I'm out there running with them. When they're doing the behavior changes, I let them know that I'm doing it too, and there's days that I struggle. Connecting with them and allowing them to know that health is important for all of us, and that they have a resource in the professors on campus. They have a resource in the School of Public Health as a whole, our building, everybody
yes.
in the building. That we are there for them to be that support is so important, because I do believe that there are people that do feel alone. I got an email, and I got to tell you, when I get evaluations and things like that, those are important. But I want to tell you that the most important kind of pieces of how I did in the semester to me are the unsolicited emails that I get. And I got one this last week from a student. And what struck me about that student is he said this: I'm here, I'm alone, I'm struggling because I'm away from home for the first time. My mental health is collapsing. Throughout the semester, I struggled. And he said, every time you came in that class at 9 o'clock in the morning, and you came in, excited to be there, passionate about what you were talking about, and you told us that you cared, and you told us that you were there to support us, that really helped me. And that's my job. And that is what I'm most proud of, Muge, is that connection piece. Connecting with those students, reminding them that their health is important, and I'm here to be a support for them.
That is the very important part, but this is our mission as a school also. All our faculty, I always say that when the people ask that, what is the difference in your school? I say that we have people, they really care about the others. So that is the bottom line for me. But as we finishing our coffee together, I just want to ask you one more. What gives you hope for public health?
What gives me hope for public health is that there are people that really care. That whether it's our faculty in environmental health, epidemiology, biostatistics, anything, that we really do care and we are passionate about what we do. And I think when you have people that are passionate about what they do, and they go into situations where they are willing to put themselves out there to really share that passion with other people, it can catch on like wildfire. And that's what my hope is. And if we didn't have people like that, and I didn't work with people like that, I don't know that I would be as hopeful. But like I said, my occupational wellness is great right now because I do work with people like that. And as long as there's people that are willing to continue the mission, to fight for the mission, to go out into the community and say we care, to go out in the community and have these programs that really promote health, I think we're winning. My mom said the win doesn't have to be the pat on the back.
Yes.
And we're not always going to get that pat on the back.
No.
As educators, as as just people, we're not always going to get that pat on the back.
Especially for public health.
In public
because
health.
nobody
Yes.
knows what we
Yes.
are doing.
But our win
Because
is
we're
knowing.
always back on the scene. You know,
That's
so nobody
absolutely
sees.
right. But the win for us is knowing that we have made an impact. The win for me is knowing that my students at UNR are making an impact in the community. That when we're going to schools or we're working with community, like Big Brothers Big Sisters and other community organizations, that we are making a difference. We're not always going to get that pat on the back, but those smiles, that's the win. That's the pat on the back.
But thank you so much for joining us to Brewing Better Health today. And
Yes.
you will get to that course. I'm not taking from you. Don't
Don't
worry.
take it from me. And thank you. I am not a coffee drinker,
But
and
you
this
like
is
it
actually
probably.
this is really good. So thank you for having me. I appreciate you just promoting health and just
Thank you so
giving
much.
us a way to be able to do that.
Thank you.